before I begin. No Pythagorean weirdness works its way into the oath. Rather, they state, here's what we take to be the upshots, the truths about how medicine's to be practiced, and there's an expectation there that in stating the truth as we see it, maybe out of our peculiarities, maybe out of the revelations that we do take ourselves to have from God, that the truths we speak will be accessible to others. We'll find points of contact with the consciences and the insights of those who are not part of the faith community. Christians should be willing to be peculiar, but to expect moral truth to be received outside the faith too. So, the main 4 points we've got here. Let's talk about the reformist intention too, because we're kind of, as I said, dealing with a point that connects back up there, and then we'll spend probably a lot of our time here with this point that caused some confusion. What does he mean when he says that the Pythagoreans had a reformist intention in propagating this oath? Yeah, Alex?
They didn't really like the way things were going with medicine.
Okay.
And
what kinds of things in particular were true of ancient Greek medicine?
Abortion and assisted or not even assisted, but just suicide.
Mm-hmm.
And arguing for it, basically.
Mm-hmm.
And they didn't really like that. So,
Mm-hmm.
and there was other concepts that were in there that aren't coming to mind right now, but
Okay.
they wanted to. They thought that this wasn't right. This wasn't.
Mm-hmm. Sex with patients.
Yeah.
The non-necessity of keeping confidences. There were a lot of things they looked at in the medical profession and thought, this isn't what we, as we aspire to be healers, want to be involved with. How could it be better? Again, drawing their peculiarities, they were horrified for very specific religious reasons at some of these things. The shedding of blood was a source of horror to them generally, not even necessarily about violence, but about bloodshed as a kind of defilement. So their reasons for opposing abortion, for instance, would not necessarily be the reasons that many Christians would have for opposing abortion. But again, they just state this is not what doctors are going to do, or this is not what we are going to do in our practice. They are not a majority opinion. This is not a gathering together of the wisdom of the profession as standardly practiced in Athens. This is, here's the weird way we want to do it. Anybody with us? Jen?
I'm not sure if this ties in, but going along that, one quote from the reformist intention section that really stuck out to me was when it said, they refused to be satisfied with the medicine they saw around them. They refused to reduce medical norms that the law allowed, what some philosophical concepts determined. And I took that personally because we live in a godless society, and with that godless society, you have people who are there's a very gray area in morality. But as a Christian, and basing my morals from what I believe the Bible says, I feel like this is a challenge to sometimes even go against the social norms of society and be like, I'm as a medical professional, like to stand up for what you believe to be correct, even though it may not be philosophically accepted, or even if say the law might allow it, but you're like, I personally don't think that it is correct to do.
This is something, I'm really glad you bring this quote up, because this is something that we can get clear for ourselves in starting off our discussions this term. When we turn to issues, there's going to be a real temptation to say, well, this is what the law says on that. This, especially when we turn to, well, let's take a topic that's in what's called the Pythagorean Oath, the Hippocratic Oath, about confidentiality. And every time this topic comes up, somebody will say, well, I know what the principle is, that if somebody says they're going to kill somebody and they identify them specifically, then you need to tell on them. And have to tell if you suspect that children are being harmed. And okay, that's a list of your legal responsibilities. We are always going to do two things. First of all, take note of those so that you have a sense of what kind of environment it is in which we need to make what decisions we make. But at the same time, we're going to ask ourselves, what should the best medicine have as its standards? Let's think together about how medicine could be at its best, guided perhaps by the truths we hold most deeply about human life and its relationship to the transcendent. And sometimes that'll involve us saying, boy, there's choices here about civil disobedience or going along to get along because you're in a regime in which, in order to have a license, you're going to have to make some sort of conflict or compromise with how things are set up. That's not the only possible response. One could also say, maybe we need to set up independent institutions and associations that facilitate us, that enable us to practice a peculiar sort of medicine. Or maybe we need to issue manifestos like the Hippocratic Oath was in its origins about, here's what medicine should be. It should be like this and this and this. And right now that's being blocked by, I'm not saying this is necessarily going to come up with confidentiality, but the state of the law will not determine our conclusions. There's always the next question, well, what about that law? Because doctors and interested citizens are all the time pushing for revisions in the law. And an understanding of what would medicine be at its best could be guiding for our engagement with the political process, thinking about, let's push for doctors to have greater freedoms, be under greater restrictions, whatever the case might be with regard to a specific issue. The law never settles it. I'm really glad you bring this up. Yeah.
Well, with those physicians who hold themselves to this higher standards, which Christians, we fall into that category. From some of the options that you said, I know you're just listening, but a lot of those, they seem like they wouldn't actually, they would work in theory, but then if you made your own institution, like you made your own Christian medical college or like your own Christian hospital, and or you made this manifesto, I feel like since as a large, I feel that this way of thinking is a minority, so it might just ostracize and bring it farther from what we're trying to do and spreading our moral reason.
So what do you think?
I'm not sure, but I think that the best way, as you said when you started the class, the best way to fix the problem is to be immersed in it, like with everyone.
Yeah, that if you want to be a physician and you think, there's these things that I'm going to be called upon to do or to involve myself with that I feel like dirty my hands, what can I do about that? One solution is withdrawal or setting up of alternative communities, and if the conflict is severe enough, you might think, that's what I've got to do. Or it might involve compromise and attempt to reform from within. But identifying, here's where the conflict is step one. Here's what medicine ought to be. I can go along with it, or I can't go along with it, but in lots of ways I can be trying to bring it about that my institutional life is more accommodating. So, several hands here. Elias, Jenna, Jason.
So is that, how does the Roe v. Wade that you brought up in here, where they kind of took the law out of it, sort of, and put it in, at least from his perspective, he says that they put it on the physicians to make that decision. They took that's at least what I took out of it.
Yeah, it's a really interesting moment in U.S. political and medical history.
But the majority of society took it as, okay, abortion is legal,
you should be entitled to demand it from your physician.
Yeah.
Was the effect on the ground. And this has to do, I'm actually going to say let's punt on that. I see the relevance, but that point came up specifically here under seeing medicine as a practice with goods internal to it. So let's hold that for a minute. But yes, in terms of people seeing, okay, it's legal, therefore it's moral. It's legal, therefore this is what doctors do. I'm reminded, and this might be an interesting example to get your thinking going. In North Carolina, a year or so ago, there was a big kerfuffle where the State Medical Association said, we will revoke the credentials of any physician who participates in the state's lethal injections, in the state's executions. We will not allow doctors to be involved with killing death row inmates. That's not an exercise of medicine as we understand it. We refuse to be involved. If any of our members are involved, they're cut off. And this big standoff between the State House and the North Carolina Medical Association. And this was a little shocking to some people who would figure, look, if we settle the law, shouldn't that settle the public morality? Do we expect the doctors to have this morality that's just their own, that governs them, that sets them against this larger legal morality? Well, there's an interesting case where it worked the other way from the way it worked in Roe v. Wade. But pointing this out, the legal doesn't settle the moral. The legal sets the context in which you're going to have difficult decisions to make about how to relate to the legal. The moral is this other question. Jenna and Jason.
I think about backing up, but I just wanted to go off what you said earlier about like how laws like constrain us and like against laws, not against law, and whether or not like we can let the Hippocratic Oath stay or make like a new one. I really liked what I think it was Megan said about how if we were to like let this be like our motto, could it actually like restrain us? And I am like prevent us from growing, and I agree with that, and that I think that it's very valuable for each person to not just be like, oh, this is the oath that I'm taking on, this is what I believe, but like to personally struggle with each scenario with your own experiences, and to come up with maybe even your own controversial like version or like decisions on various issues. I don't think that the Hippocratic Oath is something that everyone should just like agree with and be like, this is mine.
Or any oath.
Or any oath, or like a new one. Like you said, like today, like the medicine is like we're still like trying to version and go on. I think it's important that we continue to grow and not limit ourselves to like one oath, and so that we can actually develop our own like opinions through it.
Which Megan was that, by the way?
Was it you, Megan? I'm not sure.
I wondered when I read that whether setting this up in the context of community would be one way that it could be an ongoing process of growth and insight without having every doctor saying, here's my private vision of what medicine should be, and you don't know until you come to my office what it is that I might stand for. But I recognize the point. I took the point about if you see the oath as sort of setting for all time our best reflection. That's probably a problem, Jason.
So I guess similarly to kind of what Jenna was talking about, I like the idea of what they were doing at the time and the large change that they did, but don't necessarily see how the place of an oath is going to necessarily help. And in the same way, I think creating this type of image that a doctor should be almost, to me, seems not the best idea. Besides, in a majority of different fields, the doctors who fill those positions tend to fill a different type of interaction with their patients, or are different. Like, you wouldn't expect your surgeon to sit down and have a long conversation with you about you, but you'd expect that from maybe your family practitioner. Along with the aspect that many doctors, even within the same area, practice very differently from the concept of a more walk it off, or maybe they're more tough love, but the crowd that they attract enjoys that, or almost that it maybe an oath or something that provides kind of a bar and then
Right.
from that is your own.
What's the point of an
Not
oath?
a-
This is the question you're raising
Yeah.
here. It's the question that was raised in the forum and that Jen has called our attention to, and now you want to make it even more pointed. What could an oath do for us? Not encapsulate for all time our best insights that we can ever hope to have. But what can it do, Sarah?
It really just holds us to a standard.
Mhm.
It makes sure that everybody has a minimum set of requirements that they have to abide by.
Mhm.
And obviously there's the minimum like education you have to actually be a doctor, but
Right.
then in medicine there is the moral aspect of it
Yep.
where you have to have kind of, there should be some kind of guideline.
Mhm.
And an oath really is going to be the minimum of that, because
Mhm.
every person, every individual doctor is going to have their own way of dealing with different things, but there is kind of this universal agreement on some things that they
Okay.
can kind of put into an
Mhm.
oath, and everybody can kind of go off from there.
Now it's interesting, you call it minimal. Michael, in his comment on the forum, and several people following up on him, I remember Greg being one of them, said, "Oh my goodness, this is terrifying. It's very maximal. It seems to set these heroic ideals."
It does.
Okay.
But I think it's almost, I don't know, I think of it more as a guideline instead of something, like, it's not necessarily something you should always strive towards being the best Christian physician that you can be in
Okay.
how you practice.
Mhm.
But I think that the goal should be to give you kind of a baseline instead of
Mhm.
say like, you know, because not
Mhm.
everybody is going to be working towards the same goals in their practice.
Right,
Um,
sure. There's going to be special things and so on, particularly
Right.
today.
Right.
Not the case then, but still.
Yeah. So I guess there's just a difference in how you want to use the oath and how you want to interpret it.
The oath sets standards. We're all going to hold ourselves. It emphasizes, again, this communal dimension. A group of people saying together, we're going to be different, and we need some commonality that we can demonstrate. So here's what we're going to insist on. That's the kind of minimum threshold.
Right.
And maybe there's some aspirational language in there, or maybe even the minimum standards, although we call them minimum standards because we expect them to be adhered to, are really high and really demanding. It is in fact hard never to speak of the secrets of your patients, to be that careful, not even to let off steam with your family. Oh, I saw this crazy guy today, let me tell you about it. That your lips are sealed as if these are holy secrets. We'll have to talk about what does confidentiality mean in the elevator, in the bedroom, in various contexts in which it would be very human to talk about what you've seen or heard or learned or experienced, and what the limits ought to be. So it could be heroically demanding, but the idea of this is what we're all going to commit to as a community, this does seem like what's going on there.
I think that the standards, especially in this time period,
Mhm.
were more about cultivating like a trust with patients. Because especially in this time, the physician had the power maybe to heal, but he also had the power to kill and to destroy.
Yeah.
So if you're allowing this doctor to come in and, you know, he's working for his own set of goals, like
Mhm.
he just needs a new clay pot or something. I don't know. But
It's the equivalent of a big boat.
they're exchanging.
See a few more people.
But like, yeah, it's more about like trust, so that both parties can work together for better health is what he says in here. That the main goal purpose
Mhm.
of is to
This is not private. This is not something unannounced. The Pythagoreans, the people who are adopting this oath, were putting this out there as, here's a standard we're going to adhere to. Whatever standard you're used to, we're going to hold ourselves to this standard. There is a really interesting contemporary analog to this. If you think about the corruptions of contemporary medicine, there's lots of things that we could worry about and will worry about. But one of them, as psychological research increasingly demonstrates, is the subtle ways in which prescribing patterns are affected by one's acceptance of visits from drug reps. You take lunches, you take gifts, you give people access to you, and your prescribing patterns, as a generalization over the population, will change, even if you think I am a person of utmost integrity. I listen to that stuff, and I give the little toy airplanes to my children, and I let my staff have a nice lunch, and I am unaffected by this. Well, odds are you're kidding yourself. And there's a group, I don't know if they're still active. A couple years ago, they were still making a big push, called No Free Lunch. And they actually put a very topically focused oath together, the No Free Lunch Oath, in which they stated all the things they're going to refuse to be involved with, so that their loyalty will be to their patients and their patients only, and it will not be confused or conflicted by their engagements with people who want something from them other than the best for their patients. That's a really interesting analog to what the Pythagoreans were up to in the Hippocratic Oath, and I think it goes with Sarah's characterization of it here. We're going to set these new minimal standards, maybe higher than the standards than before, but our community is going to hold itself to this, and we're going to let everybody know it as a way of saying, come along and join us, because we expect these moral truths to be communicable. Okay, lots of hands here. Peter, then Tyler, and we'll keep going from there.
All right. One of the things which I was wondering about the oath is it almost seems to handcuff doctors who say want to do research, or like a lot of medicine has progressed.
This oath, you mean? The ancient Greek one? Okay.
Because
you can't do surgery, for instance, so you need to withdraw from somebody else.
Right, and then a lot of medicine has progressed from a doctor seeing something from one of his patients and then writing about it so other doctors know. And maybe he doesn't say, okay, this person, John Doe, living at this address, but they give enough detail that you really know about this patient. And then like even trying new medications where you don't know if they're going to help or not. How is that? That's not really, that's only going against the ability.
In what way does it go against the oath to try something new?
Because you're not necessarily doing what is best for the patient.
You don't know if it's going to be best for the patient. Yeah, and experimentation actually raises some really acute issues with whether you're responsible to the patient. Let's hold that thought just a second, because I think that too is going to belong here. Let's give Tyler a last word on this, and then I want to come back to what you just said and use it as a transition.
I also think it's kind of interesting how they use this, like this was their earliest method of keeping each other accountable to their, you know, to how they practice and everything. Because I mean, nowadays there, like, you know, there's so many checks and balances that, you know, from being like the possibility of being sued to like, you know, being a part of the medical community and like in that instance being disowned if you practice, you know, have ill practice or whatever. But like back then there wasn't any of that. Like you couldn't like sue a guy really for like, you know, like chopping your leg off wrong or something. I don't know. And in a way, like I guess the
You could take him to court, depending, but yeah.
Yeah.
It was messy because you know what the Athenian courts are like. You know, Socrates gets killed in one. It's about, you know, can you get 500 people angry enough to vote guilty?
Yeah, yeah. And I mean, yeah, a lot less systematic though than
Yeah.
it is today.
Not very
And-
procedurally safeguarded.
Yeah, and it was like, I don't know, I just found it kind of interesting how like, almost like the oath by invoking the gods and stuff, it was almost having this personal accountability put on each person because they were really superstitious back then, and, you know, and they were all like, you know, really, like they all answered to the gods at that time, like, I don't know, like even like the most learned of men would, you know, practice that, like, I don't know, like just think of Luther and how like his reasoning for bringing that guy to court was, you know, to honor the gods and things like that. And so this oath was almost like, it was almost like they're more like their earliest attempt at like personal accountability and to like restrain the medical practice as it was, you know, starting to grow, because they could obviously see
Twice over, they're trying to put some teeth in these standards. They see a practice of medicine that they don't admire, that they can't participate in and feel fully at home with. They say, how could it be better? What should medicine be like? They articulate it with minimal standards and aspirations, where the minimal standards are already higher than the prevailing standards. And they say, now, may God hold us to it, or the gods, and we are going to hold one another to it. And we're going to let people know, and let's see if people will come along with us. It's an excellent summary of the reformist intent. And I want to make one point. I feel like I've been talking about this chapel a lot. Last Wednesday's chapel, where Dean Jordan was talking about the formative character of worship. Formative character of worship. The oath by itself, what does it do? Something, especially if it sets standards that we hold one another accountable to. But part of the point is to mark off our identity, to remind ourselves of our identity so as to be shaped by it. In saying this, especially if it's a challenging standard, you remind yourself the next time you go into the examination room, what I'm going to hear here are holy secrets. In saying this, you remind yourself, if I go into the examination room and find myself attracted to my patient, I must remind myself that she is holy and untouchable to me. In that way, I need to preserve this very particular way of relating to the patient and not have it become sexual. In repeating the oath to yourself and with others, you remind yourself that when you confront agonizing suffering at the end of life, there are some options that are on the table and some options that are not on the table. It is liturgical. It is formative through repetition and reminding. Now, I want to turn to this, and maybe some of the things that you all want to say, Jason, and others, will continue to be relevant here. I want to make sure we get clear with this notion of medicine. It's been in the air during our whole conversation. We've been saying the Pythagoreans, the framers of this oath, saw what medicine should be, what they wanted medicine to be. But maybe the first formulation is better. What medicine should be. What do you mean what medicine should be? Can we call anything medicine? I'm going to call medicine tinkering with remote controls when they are awry. Pythagoreans and your teacher, and I hope all of you, will say, no, there's something there. There is a human practice that allows us, even across cultural and temporal barriers, to say that's the same practice. That ill health and the need for communities to care for those in ill health and to do for them what they can and to try to restore them. This is enough of a human universal that the activity of people trained and committed to be with and to try to restore those in ill health, that there's something there for us to think about. There's a topic there for us to explore, to put our best thinking into, and to try to articulate what is medicine and what is implied in medicine. What is implied in this being with the sick and suffering and trying to restore them? What goes with that? What will make that go as well as possible? This is the notion of medicine as a practice. Medicine as not just a set of skills, but as this cross-historical, cross-cultural human activity that has, and this is really the key term here, internal goods that we can try to articulate, where there are standards of excellence, minimal standards of acceptability, ideals that are bound into the idea, waiting to be articulated, waiting to be drawn out. Here's what it must mean or ought to mean to be present to the sick and suffering and to be trying to restore them in this way. Jason?
So yeah, with the internal goods, that was one thing that I had thought about a lot during this piece and reading all the reader stuff is what exactly did we want to set for that? And it seems that it's obvious you want it to be something that you're doing the best thing possible you can for your patients.
Yeah.
But in
your focus is on your patient.
Right. In a lot of cases,
which is what research is treating.
Right.
If you're going to treat your patient as a means to the end of helping some other stranger. Yeah.
Right. So kind of like how Peter had talked about, one thing that I thought about was how drugs or medicine are developed. And a lot of times it kind of includes more of the darker side of medicine where you're testing your drugs or whatever, either maybe through deceptive means or you're going to communities that have no other access to medicine or anything. So when you hand them something and say, this might help, they take it and they lack that ability. And clearly that seems like out of what we want medicine to be about.
Right.
But all the good that comes from it, it
Uh-huh.
seems that we're able to look away when those things happen. And I think, I don't know, it's hard to have a really concrete oath or set of standards if you can look away to not necessarily help all your patients if you think it'll help some others.
I love this comment. This brings us back to the point we were just making about what does an oath do, or what can an oath do. If a group of people say, okay, there are some really upsetting research practices that, yes, might drive the pace of discovery along, but that involve people who have been trained and certified as doctors doing things to people that we think doctors betray their trust when they do, and they bring down the trust that the profession needs in order to be at its best. Not even thinking of the third world cases, although those are upsetting enough, but most medical research in this country is conducted on people who are economically on the margins. Here's $1,000, you can enroll for 3 weeks in a study, and we will pump you full of all sorts of strange things to test their toxicity. Most subjects are needed for what are called stage 1 trials. Stage 1 trials are toxicity trials. We're not even trying to make you better. You don't even necessarily have a condition. We're just stepping up the amount we give you of whatever the new pharmacological regimen is until you start displaying unacceptable side effects. And you need to do that at some point, it would seem, and so we're going to have a really difficult conversation about how do you figure out what toxicity levels are, how do you get safe dosage without simply exploiting people. But look, it's a fact that a lot of people on the margins engage in an activity called guinea pigging. We're going to read a chapter about this later in the semester. Going from study to study because, it's easier than some other kinds of work that you might get. But it's deeply exploitative stuff. And we might say, is there a better way? This is exactly the kind of situation that could motivate a group of physicians to say, come on, medicine is being degraded. How are we going to be at our best? And to think together about that and to articulate, here's what we're going to hold ourselves to. Not to say that the whole world will come along right away. It probably won't. But it begins with that reformist intention, that willingness to be weird, but to invite others to see the same thing and to think with you and stand with you. Okay. Hannah, is that right? Good.
So when you're talking about the medicines that focus with internal goods,
Yes.
as Christians we need to be willing to recognize that and stand apart kind of. So,
Yeah, 2 different points there. That Christians should be willing to have weird ideas about the internal goods, but I take it Verhey wants to say that he hopes anyone and everyone will recognize the idea of medicine as an activity, practice as he puts it, that has these internal goods. Internal in the sense that they're internal to medicine. They're part of this activity. When you identify them, you're not saying, let's do medicine and dress all in red while we do it. That'll be the internal good. That'll be neat. We'll have really splashy, eye-catching uniforms. But rather, the internal idea is that there's something there already to be discovered. Caring for the sick, trying to restore them, has stuff inseparable from it. So go ahead.
So my thought is, as Christian physicians, we find our identity in our faith, most importantly, above all. But what about for physicians who are not Christians?
Yes.
And I feel like their view of medicine and how they treat the goodness that lies in medicine is shaped by, instead of their faith, by culture. And I think that's really dangerous.
Sure.
So, like what we were kind of talking about before, I just think it's important for us to not separate ourselves as Christian physicians, like a Christian hospital strictly or whatever, because I think it's important that we infiltrate and be like the salt and light to demonstrate how the high ideals that we hold kind of thing.
Okay. Okay.
Yeah, I agree with that, but what are you to do when I I talked with a doctor this summer who's working at Vanderbilt, Beverly, hospital down there, and he's a Christian, and he has been reprimanded for praying with patients in his office, like in his actual office. It came in. He's a psych patient, and they were working through things. And it's like, is it okay if you pray? And the patient, he prayed. He was very thankful, and he talked to somebody else about it. And the doctor was told if he prayed with the patient again, he'd be, I don't know what the consequence was, but he would be in trouble.
Mm-hmm.
So being handcuffed by that, he's still, he prays before he goes into every exam room and whatnot, but it's very difficult for him to be an example to the rest of the staff because he's shackled down.
Jenna, last word for that.
Oh, no. I was going to say something else. But that's really good. Is it okay if I go back to what Jason said, or do you want me to?
Sure.
Is it okay?
Mhm.
Okay. But I just thought that going off what Jason said was like a good clinical trials is I think it also connects to what Fred said about how though we have these minimal rules, it seems like there's this greater moral calling as a physician. And what Harvey says, he says, according to the oath, then the doctor is obligated not because he's a Pythagorean, but because he's a doctor. His obligations consist not only of standards based on Pythagorean doctrine, but also standards implicit in medicine.
Yeah.
And the point isn't to, it's not to, if you would violate the standards of Pythagorean, but you would fail to be a good medical practitioner by not helping the sick. And so, how can you value one human life over another human life? To what point are you a good medical practitioner by saying, yes, this clinical trial happened and this benefited this many people, or not condone it and say it didn't we weren't able to benefit this people? How can you still be a good medical practitioner? Can you be one either way? Can you be one only in one sense? What extent can you say I am a good medical practitioner?
In the same way that doctors can't be executioners, according to North Carolina Medical Association,
Yeah.
even though the members of the North Carolina Medical Association are not unanimous in their views on capital punishment. It's not that they're saying, we're all against capital punishment, here's our way of taking down the system. They're saying, doctors can't do that. Doctors, as doctors, can't be involved in that. So being an administrator who sponsors a research program might be very different from being a doctor whose responsibility is always to the ailing person who presents him or herself for care. And it may be that you can't be in both those roles at once, that this is about the difficulty of being in two quite alien sorts of perspectives toward the same people at the same time. And taking on the role of doctor means taking one particular kind of view that will not necessarily conflict with, but make it so that you can't be comfortably in other seats at the same time. That you have to say, this is my role, this is my approach. All right, I've got to let you go. On your way out, these 3 pages